essential. We all know someone who is taking medication for one reason or another, and this might just be the information they need to ensure they are preserving their liver health. We will be focusing on 5 main culprits, the drugs that, when not administered properly, can have dire consequences on your liver. The drugs we will be discussing are tylenol, antibiotics, NSAIDs, Amiodarone, and Methotrexate. But this is not the only drug that damages liver. We'll discuss it with other video. Now, these drugs aren't inherently bad. As a matter of fact, they are widely used in the medical field to treat various ailments and diseases. However, everything should be taken in moderation and under professional supervision because misuse or overuse can lead to consequences, one of them being liver damage. Tylenol, a common household name, is great for relieving pain and reducing fever. Yet when consumed excessively or for prolonged periods, it may cause serious liver damage. Antibiotics, the miracle workers of the medical field, are a boon and a bane. They cure numerous infections, but indiscriminate or long-term use may lead to liver impairment. NSAIDs, a common remedy for body aches and pains, can also pose a threat to liver health when abused, as can Amiodarone, a lifesaver for heart patients, yet a potential risk to the liver. Lastly, Methotrexate, a potent drug used to treat cancer and autoimmune diseases, can also have detrimental effects on the liver when not used correctly. All these drugs have their place in medicine. However, it is crucial to use them appropriately and be aware of their potential side effects. So let's delve deeper, one by one, to better understand their implications and how they might impact your liver health. Stick around to learn more about these medications and the path to safeguarding your liver's well-being. Getting the ball rolling with our catalog is Tylenol, a medication that's no stranger to most households. Predominantly found in our medicine cabinets, Tylenol is an over-the-counter drug that has become a go-to remedy for many individuals seeking relief from pain, aches, or fever. However, despite its wide acceptance and usage, this drug carries with it a potential risk that isn't widely known. This over-the-counter panacea, adored for its effectiveness, has a darker side. It can cause detrimental effects to one of the most vital organs in our body, the liver. Often, these adverse effects are a result of misuse or overuse of this seemingly innocuous medication. While it may come as a surprise to many, liver damage is a severe health issue and can be life-threatening if not addressed in due time. You see, our liver plays an integral role in detoxifying our bodies. It filters out toxins, aids in digestion, and more importantly, metabolizes drugs. Thus, overwhelming this organ with excessive intake of Tylenol can ultimately lead to its damage. This irreparable harm to the liver is not something to be taken lightly. It is the body's primary detoxifier and plays a critical role in metabolic processes. If the liver is damaged and not working correctly, it can lead to a host of medical complications, some of which can be fatal in severe cases. The key to avoiding such health risks is responsible intake. It's all about understanding the correct dosage and adhering to it. Always ensure that you are following your healthcare provider's instructions when taking any medication, Tylenol included. So let's delve into the nitty-gritty and further explore this subject. Coming up next in our discussion are specific antibiotics, primarily focusing on Augmentin. This medicine is oftentimes prescribed by doctors worldwide for treating a plethora of bacterial infections. The role of antibiotics in modern medicine cannot be overstated. They are our primary line of defense against bacteria, which threaten to invade our bodies and compromise our well-being. The term antibiotics refers to a wide spectrum of drugs that are used to decimate bacterial infections. But among these numerous antibacterial drugs, there's one that stands out and warrants special attention: Augmentin. This specific antibiotic is usually prescribed by doctors for several infections, ranging from skin and urinary tract infections to severe respiratory tract ones. However, with all the good that antibiotics like Augmentin do, they can also pose a potential risk. Some antibiotics are notorious for having side effects, and one of those dangerous side effects is the increased risk of liver damage. This is no minor side effect, as the liver is a vital organ that plays numerous roles in our body, from detoxification and protein synthesis to digestion and metabolism of drugs. The risk of liver damage from antibiotics stands as a serious issue in today's medical field. Clinicians often have a challenging task of balancing the benefit of treating infections against the possible harm to the liver. This risk is not equally distributed among all antibiotics. Certain antibiotics, including Augmentin, belong to the category that may heighten the risk. Now, let's dive deep into understanding why this is so. Some of the primary reasons include how the drug is metabolized by the body, interactions with other drugs, and the patient's overall health status. This is why we'll be exploring in depth the relationship between antibiotics like Augmentin and the increased risk they pose to liver health. Non-steroidal anti-inflammatory drugs, also known as NSAIDs, fall third on our comprehensive list. You may know these by more common names like ibuprofen, diclofenac, and naproxen, household staples in many medicine cabinets around the world. Over-the-counter pain relief options that many of us rely on for everyday aches and pains. They offer temporary relief for minor headaches, body aches, fevers, and inflammation. They are also frequently prescribed by medical professionals for managing more severe symptoms. But the question we pose today is, are these seemingly innocuous drugs as harmless as they seem? The answer, unfortunately, is no. Consuming these drugs, even as per the prescribed dosage, isn't without risks. One potential side effect of these drugs that is less commonly discussed is their ability to induce hepatitis, a condition marked by inflammation of the liver. To unpack that, let's break down what hepatitis actually is. Hepatitis refers to an inflammatory condition of the liver. It's commonly caused by a viral infection, but there stand other possible causes of hepatitis. These include autoimmune hepatitis and hepatitis that occurs as a secondary result of medications, drugs, toxins, and alcohol. Drug-induced hepatitis, as the name indicates, is hepatitis caused as a direct result of drug intake. In some cases, this could be due to an allergic reaction or a side effect of medications. NSAIDs, like the ones we mentioned earlier, can in certain cases lead to this condition. And while it's a rare occurrence, it is a serious one, and something all consumers should be aware of. That's a lot to take in, isn't it? Fear not, we're going to delve deeper into these specifics in our upcoming sections. So, stay tuned for this in-depth exploration. Amiodarone, a medication used to treat heart rhythm problems, secures its place on our list at number 4. This pharmaceutical wonder has been a cornerstone in cardiovascular treatment for several decades. It has proven its mettle innumerable times, ensuring that our hearts continue to beat with the rhythm they're meant to. But what exactly is amiodarone? It's a medication that's often prescribed to patients who suffer from potentially life-threatening heart rhythm problems. These issues, known as arrhythmias, can lead to serious complications if left untreated. It's a powerful tool in the medical arsenal for combating these daunting health challenges. However, despite its power and effectiveness, no medication is without its potential side effects. This is where we begin to unravel the story behind amiodarone's placement at number 4 on our list. While it's been a lifesaver for many, it has a dark side that must be acknowledged and balanced against its benefits. This dark side is the potential impact it can have on the liver. The liver is one of the most important organs in the body, tasked with filtering toxins out of our blood and helping to digest food. Any damage to this vital organ can have dire consequences, potentially leading to a whole host of health problems. That's why doctors and patients alike need to be aware of the potential risks associated with taking this medication. Amiodarone's potential impact on the liver ranges from mild elevations in liver enzymes to a severe and potentially fatal condition called hepatic toxicity. This is why vigilance is paramount when taking any medication, particularly one as powerful as amiodarone. Our focus today, therefore, is not solely on the benefits of this remarkable drug, but also on the caution needed when taking it. Knowledge and awareness are key in any health journey, and understanding the potential risks of amiodarone is part of that. Find out why it's crucial to be aware of its potential impact on the liver. Last but not least, Methotrexate. This drug, used for conditions like cancer and rheumatoid arthritis, can pose risks to your liver. Let's delve into the details. Methotrexate is primarily eliminated from the body through the kidneys. However, a significant portion is cleared by the liver. Methotrexate-induced liver injury may trigger an inflammatory response, causing hepatocyte damage. It's essential to be aware of these medications and their potential effects on the liver. Remember, this is just an overview, And if you have concerns about your medications, always consult with your healthcare provider. If you found this video helpful, give it a thumbs up, subscribe, and hit the notification bell. Share it with friends and family, and let us know in the comments if you'd like more content on the information you need to know about health-related topics. Stay informed.